Welcome everyone to the Hawaii Care Choices Healthcare Talk Story. Good morning.
Good morning.
Good morning.
Hi. Thank you for everyone that is joining. We still have a few participants that are coming in, but I'm going to go ahead and get started. It is 10 o'clock on the dot, and we love to be punctual here. We have two wonderful guest speakers today presenting, Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, and Dr. Ray Seitz, Palliative Care Specialist. Before I start, I want to ask the audience, for those of you on Zoom, if you can hear me and see the PowerPoint that's on the screen, please give me a thumbs up. To those of you watching on Facebook Live, aloha. If you can hear and see me, please comment aloha and where you're tuning in from. We want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. All right, wonderful. We are coming in clear. To our Zoom participants, if you have any comments at any time, you may use the chat feature below. Please use the Q&A box at the bottom of your screen for any questions to Lonnie or Dr. Seitz. For those of you on Facebook, you can use the comment box to chat in any questions and share your reactions with us during this talk story. While using your reaction buttons, we love to see hearts, thumbs up, and even the care button as well. I'll be asking you questions throughout the presentation too, so stay tuned. We are doing polling today. So for those of you watching on Facebook Live, you will not be able to see the polls pop up on the screen, but we still want to hear from you. Feel free to put your answers right in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I'll send you the link. Now, the polling is really simple. There's no right or wrong answers. There's a question that'll pop up on your screen. Please make the selection that you think is best and submit your polls. Just to kick things off and get you comfortable, we're going to try with an icebreaker right now. All right, so the question up on your screen is, would you rather 1, win the lottery, or 2, not have to pay your taxes? So you can choose one or the other and click submit. Again, there is no right or wrong answers, but that's a tough question to answer. And I think I would want to win the lottery. I'll pay the taxes on the lottery. It's okay. Looks like everyone is coming in clear. I see everybody on Facebook as well. Thank you. Those of you on Facebook Live, you can let me know if you would rather win the lottery or not have to pay taxes as well. And I'll go ahead and end the polling right there and share our results. So it was a 50-50 split. Would you rather win the lottery or not have to pay taxes? 50% of you said with the lottery, and the other 50% say not have to pay taxes. Well, that was a really good one and a hard one as well. I'll go ahead and stop the results there. But that is as simple as that. So thanks for participating in that poll. Now, I would like to introduce to you our guest speakers. We have Lonnie Weigert, who's the Community Relations Manager for Hawaii Care Choices, and our wonderful presenter on all of our healthcare talk stories. If any of you on Facebook and Zoom have heard Lonnie talk before, please send her comments or a chat to say hello and give her some hearts. Aloha, Lonnie.
Aloha, everyone. Aloha. Welcome.
We also have Dr. Ray Seitz, who is a Harvard-trained palliative medicine specialist who has led the development of home-based palliative care on behalf of both Kaiser Permanente Hawaii and HMSA. Dr. Seitz is an educator and a speaker about palliative medicine and palliative care locally, nationally, and internationally. In 2013, Dr. Seitz was recognized as among first of 30 visionaries in palliative care designated by the American Academy of Hospice and Palliative Medicine. She remains committed to expanding capacity for high-quality palliative care in Hawaii. And we're so grateful to have her this morning. Aloha, Dr. Seitz.
Aloha.
Thank you so much.
So glad to be here.
Yes, we are so thankful for you to be here as well. Thank you both for taking your time out this morning. Thanks to all of you who are on Zoom and on Facebook joining us. Right now, we are going to go ahead without further ado. I'm going to have everyone give a warm virtual welcome to Dr. Ray Seitz, Palliative Care Specialist. Dr. Seitz, can you tell us a little bit about your background and how you got into palliative care?
Sure. I was trained as an internal medicine and pediatric physician, and you would think that I was really interested in primary care, but I was not. I was very interested in taking care of sick people. And I loved being in the ICU. And the first half of my career was spent as a hospital-based physician with Kaiser Permanente. I began to notice that no matter how hard I worked to take care of my patients in the hospital, there were many of them who kept coming back into the hospital. And I couldn't quite figure out what I was doing wrong. I went so far as to call my patients after they left the hospital to find out how things were going at home. I made a few home visits just so I could see for myself. And I came to realize that taking care of people when they're really sick and in a crisis is really important, but that's only a small part of the whole story. Around that time, in 2001, I was attending a conference and was lucky enough to meet Dr. Susan Block of Harvard. She and her husband, Andrew Billings, had developed a palliative care program for people in practice already. And when I learned about this program, I got very excited, and I brought that back to Kaiser. My leadership fully supported my going to Harvard and participating in Dr. Block's program. I brought with me two other people, Dr. Sherry Saito and Lori Protzman, and you might know those names. But the three of us, the three amigos, went there with the intention of becoming trained in palliative care and bringing that back to Kaiser. You know, people think about palliative care in terms of end-of-life care, and there's a small bit of that is true. But what drew me to palliative care was the close relationships that are so basic in this area of medicine between the providers and the patients and their loved ones. And so I saw palliative care as not just for people who are really sick, but really holding the potential for us to change all of how we practice medicine for the better. So anyway, that's a long way around how I got to palliative care.
That is wonderful. And I love your story. Thank you so much for sharing that. You did mention, you know, people do get mixed up with palliative and hospice care. Can you please explain a little bit of the difference between the two?
Sure. You know, I also functioned as a hospice physician because when my patients transitioned to hospice, I wanted to stay with them. So I know hospice care pretty well as well. The main thing about the difference between palliative care and hospice care is basically what choices do you have for care. There are many people with serious illness who have a risk of dying, but who are not yet dying, and for whom expanded choices for treatment are viable, they're realistic, and they want to participate in stuff like, you know, if they need a surgery or if they need special expensive medications, etc. Hospice care is really care at the end of life. And so at that point in time, a lot of the choices begin to fall away. Surgeries are less beneficial and more risky. Medications may not get a person to the goals that they're trying to reach in their lives, and may carry really high burdens like feeling terrible, feeling more sick due to medication than they do to the conditions that they face. So the difference between palliative care and hospice care is that hospice care is really near the end of life. That's why the hospice benefit was crafted to be applied at the last 6 months of life. Palliative care should be available to people who have a serious illness, whether they're dying or at the end of life or not. These are people who may be at high risk of things going bad, but they're still able to function. They may decide if they have cancer that they want chemotherapy or other options, but for whom their conditions are really impacting their function and really beginning to limit their ability to live the full normal life that they had enjoyed prior to developing this serious condition. So the other big difference between palliative care and hospice care is that for the most part, hospice care is a medical benefit. It's paid for essentially by, if you're over 65, by Medicare, or it is paid for by your health plan. All health plans are required to have a hospice benefit or something equivalent. Palliative care, on the other hand, is new enough, and so it does not fall into the same benefit category as hospice. Now, some health plans like HMSA have a palliative care benefit, but other health plans do not. Some health plans are kind of testing whether they want to have a palliative care benefit. And so they have small pilot programs. I understand that, for example, United Healthcare has a little experiment that they're doing with Hawaii Care Choices. All of that is really very exciting. Other agencies like Hawaii Care Choices are developing service programs that they want to make available. It's not part of a health plan benefit per se, but the health plan has mechanisms to pay for some of these services. So some of the hospice organizations that already provide palliative care for HMSA are now trying to take those services and find a way to make them available to members of other health plans that they service. If people have questions about this, because it's kind of complicated, please, raise your hand or put them in the chat and we can address them.
Perfect. I agree. Thank you so much, Dr. Seitz. That is so much wonderful information. If the person who has, Kaiser, HMSA, or any of the insurances that allow palliative care, how would they know if palliative care is right for them? And at what point should they sign up?
That's a really great question. So the way I look at it is palliative care is specialized medical care, okay? It's specialized for people with serious illness, people for whom the risk for something bad happening is greater than other people. Their conditions are impacting their ability to live a normal life. And they're finding that they need more care. Things are getting more complicated. If you fall in that category, if your family's struggling with how are we going to take care of grandma or grandpa or whoever, then it is worth going to your physician, whether it's a specialist or your primary care physician, and to ask the question, am I right? Is my family right for palliative care? Now, I give you that advice with a little bit of a caveat. And the caveat is that palliative care in our community is not really well understood by a lot of docs. Okay, they have a lot, they think, oh no, you're not dying, so you don't need palliative care. Wrong. You don't need to be dying. You just need to be kind of struggling with your condition. The other thing is that a lot of physicians don't know what to do. Even if they think palliative care might be helpful, they don't know what the next steps are going to be. So if you are in the Hilo area, Hawaii Care Choices is a really good place to reach out for information. If you're not in the Hilo area and you are, for example, an HMSA member, you can pick up the phone and talk and ask to speak with somebody in member services or member benefits and ask, can I speak to someone about palliative care and whether I am eligible or appropriate for it? And you can tell your doctors also, if they don't know where to go, to reach out to these same resources. All of the hospices in Hawaii participate with HMSA's supportive care program. And HMSA's supportive care program is a home-based palliative care program. That means that the palliative care team sees the patient at home. They are well aware of what the criteria are for the supportive care program. In addition, because they're growing these other services, they might be able to tell you if they can offer you other services if you don't qualify for supportive care. So pick up the phone wherever you live, call the hospice in your area. If you live in Honolulu, we have Navion, which used to be Hospice Hawaii. We have Malama Ola, which is a new hospice organization, St. Francis Hospice, and Islands Hospice. And on Maui, there's Maui Hospice. There's also, I believe, Islands Hospice there. Kauai Hospice is well aware of this stuff. Again, Hawaii Care Choices and North Hawaii Hospice can be of help. Kona can probably give you some information. I don't really know if they are developing other service lines for this kind of care.
Okay, well, that is wonderful. To our participants on both Zoom and Facebook, if you have any questions on where to go, I know Dr. Ray has laid out everywhere in Hawaii State. So thank you so much for remembering all of those places as well. If you have any questions, feel free to chat in to both Facebook and Zoom. Dr. Seitz, if palliative care is right for someone, does it mean that they have to choose a different doctor besides their primary care doctor?
If someone is appropriate for a palliative care program, those programs are led by a team, and the team consists of a physician, sometimes a nurse practitioner, an RN, a social worker, and a chaplain. Those are your basic core team members. At least one of those core team members should have special training and certification in palliative care. Yes, you would get a different team, but part of what that team does is to work very closely with all of your other doctors to make sure that the care that you receive is coordinated, it's streamlined, and everybody is working from the same page. When a person gets really sick and they're seeing multiple specialists and they have their PCP and they may have a case manager, whew, that's a lot of people involved. That's a lot of cooks in the kitchen. And currently in our medical system, it's really difficult to identify which one is the captain of the ship. And even if you identify the captain of the ship, say it's your oncologist, there's no guarantees that that oncologist or that team is going to communicate with everybody else. But because palliative care, the core procedure, if you will, of what palliative care does, like, take, for example, a surgeon, their specialty may be and intestinal surgeries or lung and heart surgeries. The specialty of palliative care is basically our ability to communicate with everybody and to coordinate. So this team of palliative care specialists will be responsible for coordinating the care with all of your other doctors. So you don't lose anybody. You get an extra layer of support on top of everything that you are currently getting. And the beauty of it is that, number one, they can spend the time talking to you and really coming to know you and understand what's really important to you, and taking that information and helping you craft a plan of care, and then taking that plan of care to everybody else so they have an opportunity to weigh in and make suggestions, and then everybody's singing from the same page of music. And that means that, for example, if you got to go to the ER or you got to go to the hospital, when you go to the ER or the hospital, you stand a greater chance of the people in the hospital in the emergency room understanding better what is appropriate for you and how to work towards your goals, even in those times when things are kind of in a crisis.
Well,
I hope that answers the question.
It does. It sounds like a very encompassing program as well, where everyone's talking to each other, everyone's on the same page, which is really comforting for the patients and families.
Right.
Another question is, does receiving palliative care mean that one is giving up hope or going to possibly die soon?
You know, that's a really great question. And from my point of view, it is exactly the opposite of giving up hope. It really is uplifting and enables people to become much more optimistic while they are being grounded in the reality of what is going on with their condition. Hope is a tricky thing, you know. I don't know that you can ever cause a person to give up hope. Because it just comes from a deep and spiritual place that really medicine often can't touch. But here's what I can tell you about palliative care. The data is that with good palliative care early on, people live longer. Their quality of life is better. Their satisfaction with the care they get is better. There's less crisis. Their families are supported. They begin to understand what is going on, why it's going on, why the treatments work the way they work. And so they become much more in control of what's going on with them and what is being done with them, for them, and to them. All of that is really, to me, uplifting and enables people to calm down, to feel like they're in control, because they will be, and to be able to weather whatever storms come in the future. But I want to make it really clear, palliative care is not about dying. Okay, all of us are going to die, right? Nobody lives to even like 200 years old. Nobody. So all of us are going to come to that point in time. But the real question is, how are we going to navigate from now until then? And palliative care really optimizes all of the ability of people to understand things and prepare and make good choices. It reduces crises. It reduces the kind of suffering that we see so often in our current medical system. And all of that frees us up to be much more open and active and optimistic. So I don't think it's about losing hope and dying. No.
Thank you so much for that. In all the talk of how wonderful palliative care is as a whole and the team that supports and comforts the patients and families, I have a question from the audience. Why doesn't all the health plans offer a palliative care benefit? And is there anything the public can do to get it?
Oh, that's such a great question. And yes, I'm going to answer the second question with a yes. There is a role that you can play, and I am going to ask you to play that role. Why don't the health plans pay for this? Well, just so you know, the second part of my career was spent at HMSA building supportive care as a statewide program and engaging with leadership of HMSA. Luckily, I worked under some pretty visionary leaders, including Hilton Rathel, who now heads Healthcare Association of Hawaii. When I first met Hilton, it was in a quality meeting. There were a whole bunch of doctors. I was a guest. I was still working at Kaiser at the time. And HMSA was kind of interested in the work that I was doing at Kaiser in building palliative care. And I heard these people talk, and Hilton was there. And of all of the people from HMSA, I felt that Hilton really understood quality the best of all. And I decided I wanted to work for him. But Hilton is sort of a rare bird, because he's not so interested in counting beans. He's interested in caring for people. And health plans have a mix of decision makers who, some of whom really get what it's like to be at the bedside, what it's like to care for someone. And then there are healthcare executives who just say, I want the bottom line, show me the dollars, because I don't know that we can afford it. And when you look at palliative care and you see that you need a team, that team has to be available 24/7. You know, you're paying for people to come into the home, you're paying for medications and all that kind of stuff. Some people in healthcare are really scared that it's going to be too expensive to pay for palliative care. And I think that's probably the biggest barrier to health plans offering this as a benefit. Now, there's much more experience now under our belts. So Kaiser, when I was at Kaiser, we built home-based palliative care, and we collected really good data. And we showed that with this kind of a team, you could not only give better care, get people much more satisfied, much less crisis-driven care, reduce suffering, and you can do it for less money. So that began to get the attention of some of these health plan executives, because, you know, overall, they do want to have the reputation of providing good care. So that's why I was hired at HMSA to help them build a similar program. And what we showed at HMSA, again, was that people love this program. People, not only the patients and families, but the providers who referred their patients to palliative care. And some of them initially were really scared because they thought, oh, you know, I'm sending them to people who are just going to give them morphine and let them die. And they began to see, oh my goodness, this is really something very different. And their patients would go back and say how wonderful it was, and thank you for the referral and so on. That people in healthcare began to see the value of this kind of care. Now, HMSA has palliative care as a covered benefit for Akamai Advantage. It's a covered benefit for most of their commercial lines of business, for many of the self-insured. And EUTF has agreed to let palliative care be available to their retirees under a pilot program. Palliative care now is, Quest is included in HMSA supportive care coverage. So there's that. Other hospice organizations are creating, like I said, these alternative service lines so that they can provide some of these services that outside of the actual benefit called palliative care. One really exciting thing that is going on right now is that MedQuest is working very hard to create a palliative care benefit for MedQuest members. And their intention is to take this idea of the benefit to CMS, which is the federal government's healthcare organization, and to say to them that the feds should cover at least half of the cost of this benefit. And I think they're going to get there. It'll be the first in the nation of its kind, which is very exciting, but it will also help us catapult our efforts to make palliative care available to everybody with a serious illness who wants it. If MedQuest can do this, we are going to be so far ahead, because all of the health plans who want to have a MedQuest contract will have to provide this benefit. So there are really exciting changes that are coming down the pike that you should be on the lookout for. So what is your role? I think your role is to talk up palliative care. If you think that somebody you know might benefit from palliative care, encourage them to go talk to their physician. And don't be put off if the physician doesn't understand what palliative care is, because they're going to need some education about it. And part of what motivates doctors to learn about something is to hear about it from their patients. Okay. And if you find yourself in a position where you really want to pursue this, but your PCP is not really helping, then call Hawaii Care Choices or call one of the other hospice organizations. Go look up on Kokua Mau's website how you can, who you might call to get more information. Don't give up. Call me if you need to. I might be able to, direct you towards where you might be able to get more information. But don't be an advocate for this kind of care. Be loud and proud about it. Don't be put off if your physician is less informed than you are.
Okay, well, ladies and gentlemen, you heard it from Dr. Ray Seitz herself. Be loud and proud about palliative care. Advocate for yourself, definitely. And again, yes, visit the Kokuoma website. If you are off island, if you are in our service area of East Hawaii, please call Hawaii Care Choices. I will definitely put our number down in the chat box. Dr. Seitz, I know there is one last thing that you wanted to share with us. I think we have a slide coming up for you now. Thank you to everyone who's joined us. That was so much information on palliative care. And I'll take it back to you for this, your slide.
Great. So, I've been a proponent of palliative care since I learned about it in 2001, and I was one of the first physicians to become board certified in hospice and palliative medicine in the state of Hawaii. So I've seen this area of medicine struggle and grow and develop, and I believe that we are now at a tipping point. We are now in a situation where we can seriously talk about expanding access to this kind of care to everybody with serious illness who might want it. But we still have a lot of work to do to make that happen. So some of us decided that it was time for a new organization to be formed, whose vision it would be to increase access to everyone in Hawaii with a serious illness, and to be able to provide this kind of care in the setting that they would prefer. So we developed an organization called Hui Pohala. We're a collaborative organization. You see the logos at the bottom. These are organizations that are part of our leadership group. At the top there is our website. So I encourage you to go to our website. We've just created it, so it's still a work in progress, but there's lots of really good information there. And they're through the website, you can contact us And also, Trisha and Lonnie, you guys are free to share my email address to everybody, because I love to hear from people and love to understand what's going on in the community. So people should feel free to reach out to me and to reach out to Hui Pahala. Please join us. We're working on increasing awareness about palliative care, both for the public and for the provider communities. We really want to understand how to provide this kind of care to underserved communities and communities in rural areas, because we know that that the services are not the same on the Big Island as they are in Honolulu. And we really want to work to fix that problem. We're also working on expanding the workforce, because we know that in order to provide palliative care, that more people will have to be trained to be able to do that. So many of us are working in that area as well. We're working with the health plans to help them figure out how to pay for this and how to make it a benefit. We're working with MedQuest, and we're working to understand how to measure quality and how to measure our progress towards expanding access to palliative care. So if any of this sounds interesting to you, please reach out to Hui Pahala. We can use your help, and we would just love the partnership.
Wonderful. Thank you so much, Dr. Seitz, for your all your knowledge and your information and your stories on palliative care too. We really appreciate it. We appreciate the time that you've taken to join us on our Healthcare Talk Story this morning. And with that, I would like to let everyone know, Dr. Seitz, if you'd like to stay on just for a few moments, if there's any additional comments from the participants, you can go ahead and chat that in. We are now going to turn the presentation over to Lonnie Weigert. Thank you so much.
Thank you so much, Dr. Seitz. That was incredible. Oh my God, what a champion for palliative care. We have yet to meet such a champion, and the fact that you are going to raise all ships in the harbor, I mean, that is going to be incredible, that across the state, we could at some point provide palliative care. And as you know, Hawaii Care Choices, we're quite big believers in palliative care. But the fact that you're going to, pioneer it for all of the non-believers, which I thought was so diplomatic how you shared that with us. That it's just hilarious to me that you're just going to forge ahead and really help provide this to everyone. So that's really great. Thank you so much, Dr. Seitz, for taking the time to join us. It looks like everybody has already put in their questions, which Tish went ahead and asked you. You were so eloquent in answering everything. I know we have a very inquisitive group,
That's awesome.
That wants to know so much about palliative care. Again, thank you so much. And thank you for spending the time with us to share with our community, not only here in Hilo, but also across Facebook as well. And we are recording this to put on our YouTube channel as well, so people can tune in to see you later on as well.
Okay.
So thank you again.
Well,
thank
it was
so
a pleasure. Hawaii Care Choices and I have a long history of partnership, a very long history of partnership. You guys were an incredibly valuable partner in helping us to develop, design, and roll out supportive care. And of course, Dr. Dolan and Brenda Ho and Lonnie, we've all had our little projects that we've worked on together, and all of it has been so wonderful. And I look forward to continuing the partnership. Perhaps Hawaii Care Choices could be listed as one of the collaborators with Hui Pahala.
That could be something.
Yeah, I'd love to see the logo there. Okay.
Awesome. Thank you again, Doctor. Thank
Thank you
you.
so much. Bye-bye,
Aloha.
everybody. Take care. Aloha.
Okay, we can put our slide deck up.
Yes. Thank you so much.
Oh my gosh, she was incredible. She was incredible. The programs that I'm going to share really quickly with everyone is mainly palliative care and hospice. So we're going to like jump in the deep end on that. And then I'll touch briefly on bereavement as well.
Okay, awesome. I just want to say to everybody on Facebook and Zoom, you are now available to chat in questions or answers, or excuse me, questions for Lonnie that can be answered. And you guys on Facebook as well, use the comment box to chat in. All right, here we go with Lonnie's presentation of our 3 main programs.
Thank you. Okay, so what is palliative care? First, I want to just reiterate what Dr. Seitz said. She said palliative care allows people to live longer, have a higher satisfaction with the quality of their care, because of course the quality of their care is more intentioned and robust. Also, the patient and family, they tend to have more control on their care as well. So they don't have as much anxiety about, oh, you know, what should I do? Why are we doing this? On and on. I mean, there were so many positives, but the part that I loved was that it boosts the quality of life. It supports the family and the patient, and it actually extends the length of life, probably because there's so less stress. And the fact that Dr. Seitz is just going out there and just screaming from the top of the mountain about how great palliative care is, we find her to be such an advocate with us with regard to letting people know, if you are suffering from a serious illness, and serious illness that we are talking about is cancer of any type, COPD, congestive heart failure, and kidney failure. Those are very serious illnesses. Definitely give us a call. So for us, palliative care, after just listening to all of the things that Dr. Seitz said, palliative care really focuses on providing relief of symptoms that occur, because when you have a serious illness, normally you're doing some kind of treatment, whether it be chemotherapy, radiation, whatever the situation is. There's normally symptoms that occur because you're getting this treatment. Symptoms such as pain or fatigue, nausea, all this other stuff. So palliative care is dedicated specifically to providing relief for those who are dealing with these serious illnesses. And of course, like I said, boosting that quality of life. People still got to go Vegas now, you know, and so it's wonderful to have palliative care and be well enough to go.
I agree. And those of you on Facebook and Zoom, please give me raise your hand or a thumbs up if you have learned that palliative care boosts quality of life for patients and families and focuses on relief. Send Lonnie that thumbs up.
Yay, awesome. Awesome team. I love it. I love it. So who is appropriate for palliative care? I don't know. Most people will probably not know that it's palliative care is available to any age, even children, all the way down to babies. So the serious illnesses that I had mentioned, COPD, congestive heart failure, cancer of any type, kidney failure, all of those very serious illnesses, please call us. And of course, anybody who is dealing with serious illness, you do not have to wait till you're getting a terminal illness. For most part, we tell people as soon as you get a diagnosis of any type within these diseases, please call us, contact us right away, because the sooner you do, the better it's going to be for you.
I agree. And if you agree with Dr. Seitz and Lonnie, be loud and proud. And if you know somebody that could benefit from palliative care, raise that hand or push that care button, Facebook friends.
Yeah, awesome, awesome. Thank you, everyone.
Oh, and that is my cue. All right, for another brain teaser. The brain teaser question is up on your screen. The goal of palliative care is to improve the quality of life for patients and their families. True or false? Again, those of you on Facebook Live, you will not be able to get to see the polling. However, please chat in your comments if you think the goal of palliative care is to improve the quality of life for patients and families. True or false? I am taking a look at those, so please chat in those your answer. All right, and looks like everyone is still with us and awake, had their coffee. I love it. I'm going to go ahead and end the polling right there and share the results. So the goal of palliative care is to improve the quality of life for patients and their families. 86% of you said true, 14% of you said false. Thank you so much for joining in on our first actual polling. Back to you, Lonnie.
Thank you, everyone. Thank you, my Facebook friends, for weighing in on that one. Yes, for the most part, I tell you, palliative care is going to help and support not only the patient, but the families, especially with regard to boosting that quality of life. So great. Thank you so much for weighing in on that. And people will say, well, when should I sign up for palliative care for myself or my loved one, whoever the situation might be for? Some of the signs, without being a doctor, are physical. So if you find that you or your loved one tend to either be calling your doctor a lot or going to visit your doctor, or maybe even going to the emergency room often, and often is like, 3 times in a month, that is definitely often, give us a call. And also, a lot of times, when there's a serious illness, there's more than one doctor that you're seeing. And so as a result, there's a lot more medications to manage. And so call us as well if you start to get confused, because that's when the specialty palliative care team can really help communicate and coordinate. 2 very important things that Dr. Seitz said as well. And also, you'll notice that if there's need for support, it's difficult to do just some of the basic activities of daily living. Going to the store, making a meal for yourself, doing some light housework. All of that will really have an impact on you if it's time to get support with palliative care.
Yes, and I want to go ahead and engage our Zoom people and our Facebook friends. Send us a heart. Zoom friends, please raise your hand if this helps you know when palliative care is needed.
Yay, awesome, friends. So good. Thank you so much for weighing in on that. So when should palliative care begin? Like Dr. Seitz said, and most physicians will say at time of diagnosis. So say somebody is diagnosed with breast cancer, there's a lot of emotion that's going around that. And, the last thing people are thinking about is signing up for something else. I want you to know that it is good to sign up early, because then you can get familiar with what the service is and what is entailed in the care. So as soon as the diagnosis is provided, go ahead and give us a call. And then, of course, we will be able to then really prepare you as you go on this journey and, hopefully really boost that quality of life for you quite early in the journey as well.
I agree. Everyone, give me a thumbs up if you believe those with serious medical issues could live longer by signing up early.
Yeah, thank you so much for giving the thumbs up. Great. Okay, so what to expect when you sign up for palliative care? So first of all, we have a specialty team that is assigned. And so the nurse of that team will come to the home, do a quick evaluation, medical history, get your blood pressure, that kind of thing. But really, what's so important to the team and that nurse that comes to visit is what are the biggest concerns that you or the patient or your loved one really have around this illness. And it could be one of the concerns is, I just want to be able to join my family for my grandson's graduation. I want to be well enough to do that. Or I want to be well enough to go on the family vacation to the mainland. Or something as simple as, I just want to be well enough to get off the sofa and walk to the mailbox, get the mail and come back without completely being breathless. And so really, it's the human side of the illness that we want to know about, what's important to you and your family. And that's what this specialty team is really, really good at.
I agree. Everyone raise your hand if you'd like this type of service for your loved one.
Medication review. Okay, so I mentioned that before, and it's because those with serious illness, they normally have more than one doctor. You know, they go to the oncologist, they go to the cardiologist, they go to some ologists in addition to their primary care physician. Well, most of the time, all of the medication is assigned by different doctors. And so it is quite difficult at times and challenging to organize all of it. And so this photo over here with this man and woman trying to balance all of their medications, that's no joke. I mean, there are times where we have gone to people's homes and there's more than 50 jars of medication on their coffee table. But we found that once our specialty team comes in and then reviews all of the medication and then lets the primary care physician know, you know, a lot of times instead of taking 36 different medications a day, they might be taking 18. Although 18 is a lot, it's still not 36. So what I'm saying is it's really important to have a specialty team like palliative care to come on into the home and help really navigate through all of these challenges of trying to maintain good health.
Yes, and if anyone can relate to that story, please type yes in the chat.
So how does palliative care work? Well, basically I told you that we focus primarily on relief of pain and the symptoms that happen because of all of the side effects that happen due to serious illness. So our team will come in, we will communicate with everybody that's involved in the family. We will coordinate all of the different appointments that everybody has to go to. And then we'll come up with a plan of care, including the patient and the family. So it's not where a plan is just delegated to the patient and family. They're all a part of it. They are the reason for it. And so we really look at how can we be a support, even spiritual support if that is needed during palliative care.
Yes, everyone raise your hand or send us a heart if you think this is just an amazing program.
Oh, thank you folks for sending the heart. That's so sweet. Thank you. Thank you so much. Okay, how is palliative care paid for? So that is often the question. People will say, well, you know, it sounds like it's a really expensive service. Well, for the most part, if you have Medicare, the visits will be covered. And those who have visits from our provider or our social worker, those will be charged at the same rate or similar rate as one would be charged when they have a regular doctor's visit. So it could range anywhere from $20 to $40 a visit when they come to see you at your home. However, if you also have Medicaid, then there are no co-payments at all. So again, Medicare and Medicaid will eliminate any co-payments at all if you have both. And so this is a good time to determine whether or not you qualify for Medicaid as well if you don't have that.
And again, I just want to let everyone know if you have any questions, feel free to put it in the chat for Lonnie.
Oh, and I just wanted to add that the regular insurance, UHC or HMSA, they also provide coverage for palliative care, but there still would be a copay if you don't have Medicaid as well. Okay, let's move on now to what is hospice care. So the difference really with hospice care is definitely end of life care. And the focus on hospice care is really about comfort. It isn't about any heroic surgeries. We're not trying to cure anything at this point. We are just trying to keep the patient and the family as comfortable and as supported as we can. So hospice care, it has a whole different philosophy about it. First of all, hospice care is a subset of palliative care. So that's why a lot of people get confused. But again, remember I told you that palliative care is about focusing on relief. Hospice care is about focusing on comfort. Very close, but still different. And it's really about the quality of life when it comes down to hospice care. It isn't how long you're going to live. It's really about the quality of the time that you will be living. And that makes a whole lot of difference. A lot of times people who are doing treatments, their quality of life starts to diminish where they can't eat anymore. They're losing so much weight. They can't sleep. They're in a lot of pain, etc. Sometimes people weigh it one way or the other and decide, you know what, I just want to be with my family, being around them and just spending that quality time together instead of trying to, lengthen their life and being miserable while doing that. So again, hospice care was created to ease terminal suffering. That doesn't necessarily mean that it's automatic death. It really does mean that sometimes when people are suffering so much, death is not the enemy. And so being afraid of hospice care is completely misunderstood. It's really how much support hospice care is going to provide and how the quality of life is really going to be boosted because of it. Again, the focus is on comfort.
And we want to hear from all of you. Please type in the chat if you think you would like quality or quantity of life for your loved one.
What is hospice care again? So there is a specialty team, just like our palliative care. There is our specialty team that comes out, and these are all the people on the team right here. There's a whole bunch of people that come, and believe me, we don't all come to the house at one time. So don't be concerned about that. But it's good for you to know that we have an entire team working on your case. And it's so important to us because it's all about, again, the quality and the comfort that we are able to provide and support to the family. So I remember when my dad told us that, all he wanted was to pass at home. That was his only wish. And he was suffering from congestive heart failure. So we thought, gosh, this is so easy for us. With regard to his final wish, we can certainly have him be at home with us when it's time for him to pass. But sadly, one evening he couldn't breathe and we called 911 and they took him to the hospital where he passed before we even got there. So that was such an epic fail for us. However, years later, when my mom was diagnosed with lung cancer, her doctor said to us, which we were so grateful that the doctor took the time to say to us, hey, your mom can have hospice care at home. And once we found out what hospice care was, I immediately told him that there's no way that my stoic Hawaiian mother would ever accept hospice care. But he said, well, you know what, give it your best shot because it would really, really boost her quality of life as well. So I went home and I let her know. I said, Mom, guess what? You qualify for a hospice care at home. And then she said, what? Oh, that's terrible. I mean, she was even frowning, like how I'm frowning to you. She said, no, I don't need that. I'm going to live a long time. I don't need that hospice care. And then I said, oh, okay, so you're obviously not into it. She says, no, I don't need that. I said, oh, okay. Well, anyway, I mean, I heard we could get free stuff. And then she says, oh, like what? In any case, we were able to sign her up because obviously she felt that if we were going to save money, then that would be a great idea to have hospice care come in, because by that time, my brothers were renting her wheelchair and other things. And, you know, when we signed up for hospice care, she got the hospital bed, oxygen, things that she wasn't even using yet. But she was so impressed that it did come. And in fact, it was paid for 100% by her Medicare benefit. So that was another really wonderful thing. Of course, she was quite saddened after many months, and she lived well past 6 months because of this loving intentioned care that she was getting from her hospice team. She then mentioned to me, "I'm so sad that Daddy didn't get any of this." And I said, "Yeah, I know. What the doctor didn't tell us. We didn't know." And she said, "Yeah. So you know what? You go out to go tell all the families over here, all the neighbors, everything, they sign up for hospice too." And I said, "Well, you know, it's a little awkward right now, Mom, for me to go and ask them because, you know, it might not be relevant right now." She goes, "Oh, okay. Yeah, that makes sense. Well, you know what? You promised me that you will go and figure out how to tell everybody about this wonderful hospice program, because I know that many people are going to pass away without knowing about this benefit, and they're going to suffer, and their family's not going to get the support like us." So here we are 10 years later, where I'm out here just sharing it with everybody that will listen on what a beautiful, beautiful benefit hospice care really is.
Lonnie, I appreciate your story. Everyone, just send Lonnie some hearts and comments on just that beautiful story that she always shares with us.
Oh, thank you, everyone. I see those hearts. Love you guys back. Love you right back. Okay, so who qualifies for hospice care? Oh, the person who is suffering from terminal illness. Okay, so they have to be diagnosed. And, you know, a lot of times the doctor is just making the best guesstimate with regard to the time that a person has. So the doctor will make best guesstimate of 6 months or more to live, and patient is no longer seeking curative treatment. So they're not going through any surgery, they're not doing chemotherapy, they're not doing dialysis, they're not doing any treatments at all. Those are the ones that will qualify for hospice care.
All right, everyone on Facebook and Zoom, raise your hand or give me a thumbs up if you now understand how people qualify for hospice care. All right, that's also our cue for the next brain teaser that is coming up right now on your screen. So hospice is where you go in your last days, true or false. Again, no right or wrong answer. Please click the answer you think is best and hit the submit button. Those of you on Facebook, feel free to chat in your answers as well. All right, looks like everyone is coming in clear. I love how fast everyone is responding today. Everybody's got their coffee. I've had mine already. Thank you. Great job. Okay, I'm going to go ahead and end the polling there and share the results. So hospice is where you go in your last days. 50% of you said true and 50% said false. Thank you so much for participating in our polls. Back to you, Lonnie.
Thank you. Thank you, Brenda, for that beautiful comment. Sending love right back to you, Brenda, sending it right back. So for those of you who just answered that polling question, the sooner, the absolute sooner you can send your loved one or yourself signed up for hospice care, the better it is for you. A lot of times people will say, "Oh, you know what, let's don't call until, you know, mom's no longer eating, or mom can't sleep anymore, or mom is in a lot of pain." No. You want to call as soon as you're able to get a diagnosis from your doctor, or the prognosis from your doctor that, you know, your loved one has 6 months or more to live. And definitely call us then. The reason I say that is because, you know, I liken hospice care to a level of service. And let's just say, you know, all of us are going to go on Heaven Airlines. Some of us will go in at we'll take the 2:00 flight. Some of us will take the 6:00. Make no mistake, we're all going to take this flight to heaven at some point. Well, for those who have signed up for hospice care, they will come onto that flight and go directly to the first class cabin. And they'll not only go just that patient, but the whole family will go with them. And the reason they will go to the first class cabin is because that is where all of the comfort resides. That is where the family will be kept together, supported for the entire journey. And believe me, it's oftentimes the most toughest journey of all. But for everybody else, for whatever reason, does not sign or did not sign up for hospice care because they either didn't know or they're afraid to, whatever, they enter the airplane, but they don't even go to the coach class of the airplane. They go, sadly, to the baggage compartment of the airplane. And the reason they go there is because without hospice care helping them to their final journey, they are going to go on the roughest, really coldest, bumpiest ride to the end. And although their loved one will cross over the bridge to heaven, the rest of the family will take that horrific flight back. And many, when they arrive, just break into a million pieces. And it's so very difficult to pull everybody back together once they come back. So I tell you, again, hospice care is not only for the comfort and support of the patient, it is really for the support of the family as well. And when I say support of the family, a lot of people don't know how to just do a bed bath, or they don't know how to just wake up one day and I'm resilient today. I won't have a problem when my mom passes away. No, all of that, we're not just born with it. We need to learn how to be prepared for that. And hospice care brings all of that with it. So again, if there's anybody that's concerned about whether or not they should call hospice early or not, call us early. And when people ask me, well, how will I know if my mom is ready for hospice? Take a look here. It's like, you can see that there's physical changes. Mom is losing weight. Maybe her skin is breaking down. Maybe we're going to the emergency room a lot, or maybe we're calling the doctor a lot more. Maybe mom can't even get out of bed. Definitely give us a call then.
Yes, I agree. And please send us that care button or raise your hand if you know someone with these symptoms, or send Lonnie some hearts for that Heaven Airlines story.
Thank you, everyone. So how does hospice care work? Like I told you, we have a specialty hospice team that comes to the home. And again, we don't all come together because we know that local people don't like that. So no, we'll only come one or two at a time and really take care of not only the patient, but the family as well. And other things would be included. Like I said, my mom had no idea that she could get a hospital bed and oxygen and all of her medications that were associated with her prognosis. So please give us a call as soon as you can.
Yes, or raise your hand and give me a heart if you know somebody that would benefit from these incredible services.
So when it comes to hospice care and even palliative care, we are really focused on what is the most important thing to the patient and the family. And once we talk about that and get that out in the open, then we create the plan of care that really makes sure that all of the needs of the patient will be met and that the team will be focusing on that as well. So everything centers around the patient, and it really determines how often the team needs to come and visit the patient and all the other support items that might be needed for the family as well.
Right, everyone, Zoom or Facebook, please raise your hand or give me a thumbs up if you learned something new. Okay, there is our wonderful brain teaser yet again. I'm going to put up the polling questions. And the question in your screen is, my culture expects me to take care of my family with healthcare needs at home. Strongly agree, agree, neutral, or strongly disagree. Again, those of you on Facebook, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put up your answers right there in the comment box, or send us a thumbs up or a heart if you are enjoying this presentation. Everyone's welcome to join the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I'll send you the link. Looks like we have everyone giving their answers. I'm going to go ahead and end the polling there and share the results. So my culture expects me to take care of my family with healthcare needs at home. 40% strongly agreed, 40% agreed, and 20% is neutral. Thank you so much for joining in again on our polling. Back to you, Lani.
You know, it's really great to see that 80% is starting to shift with regard to their understanding that to take care of their loved ones, it's really, really important to bring in those that have the expertise to do so. I remember when we were growing up, my mom would take care of my grandma, and at some point she realized that she needed to bring somebody with more expertise in and not feel guilty about doing so, because then by doing that, she became a better daughter to my grandma. So I want you folks to know, give us a call. We're here to help you folks. Okay, so right here is Pohai Malama, and it is a beautiful, beautiful. It is by far the Mauna Lani of hospice and is located in Hilo. And so this is a very special type of care center. This is not a long-term care facility. People come here when they have symptoms that cannot be controlled at home, or maybe possibly even at the hospital where they're trying to get home, but they're unable to control their symptoms, and so they stop here before going home. What often happens is those that are on hospice care at home, and maybe they're having a challenge, and so something happens where they come to this facility here, we will help stabilize them, especially their symptoms, and then send them on home. Now, there are times that for those people, they are actively dying already. And when they do come to the facility, we keep them as comfortable as possible. We welcome in the family as well. And then we allow them to really have some comfort with their family. And many of them do pass here at this facility. So for those of you who have Medicare, Medicare does cover the portion of hospice care. However, room and board is additional. So room and board is normally covered by Medicaid. And for those who do not have Medicaid, they are able to pay private pay as well.
I agree. This is just a beautiful place. Type yes in the chat if you'd like to see a virtual tour of Pohai Malama to learn more.
So how is hospice care paid for? Like Dr. Seitz said, I mean, all of the health plans have some type of hospice care benefit in it. And actually, all of them do. And so it is covered by Medicare, Kaiser, Medicaid, et cetera, and all private insurances. And so that's why, you know, although my mom didn't have any other health care plans when she passed away, she did have Medicare, and Medicare, again, covered hospice at home 100%. Our family did not have to pay even a penny.
Ladies and gentlemen, raise your hand and give us some hearts if you love that hospice care at home is paid 100% by Medicare.
So our volunteers are known as our earth angels. We absolutely adore them. They come into the home and they provide respite for the caregiver. And believe me, because there are a lot of people that believe that they need to be the one that cares for their loved one, it sometimes becomes challenging for us to convince them that it's time for them to take a rest. Well, this is the reason why they are able to take a rest, is because one of our trained volunteers can come into the home and be with their loved one and patient, and do whatever it is that really brings joy to the patient. So it could be, together they're going to knit, or they're going to listen to music, or they're going to play cards, or they're going to maybe go on a drive because that person likes to look at the beach because, they were either a waterman or waterwoman at some point in their life, and they really love looking at the ocean. Those are kinds of times that the caregiver is provided a time to rest. And that is so very important. We found that even caregivers that would fight with us in the beginning and say, no, I have to watch my husband. Once they give in and they do take the, multiple hours of rest that is provided by the trained volunteer, they are actually a much better wife and caregiver afterwards. So, everybody needs time to rest. And it's important that our caregivers really take that time, because we do find that caregivers can often become sicker than their loved one that they're caring for if they don't take care. And we make sure, as part of our hospice benefit, to help the family in that way, especially the caregiver.
Yes, and I would just like to, if everybody could join me and give a virtual round of applause to all of our wonderful volunteers at Hawaii Care Choices. Yay!
And so now for bereavement, what's really important about bereavement care is that, it's so very difficult to get through the grief of losing a loved one. We do have bereavement care. And so please contact us for more information about this. We also provide community bereavement for those who maybe didn't have a loved one in hospice care, but something happened, maybe a car accident or something very unexpected, and grief is difficult to deal with. Please contact us as well so that we can help support you and get you through that very, very difficult time.
Yes, and give us a thumbs up or a heart if you know somebody that could benefit from this program as well.
So our mission is right here. Really, we're all about trying to improve the lives of both of our patients as well as our families, anybody that we come into contact with. We really want to lead with love and compassion at every step. And our service area is all the areas that are colored here on the map. So from Lapuahoi Point to South Point Ka'u, we cover all of that area. And so please give us a call if you are located in any of those areas.
I also want to ask if you are tuning, or if you can chat in the comments where you are tuning in from. We definitely want to know.
Awesome. Thank you so much, you folks, for weighing in on that. It's so interesting to see how far our reach is and where people are signing on to listen. So we really appreciate that as well. And this is information on where to call or where to email, or maybe just even asking your doctor about both palliative or hospice care if you believe that you or a loved one could use any of those services. We are so very honored to be able to provide those services to our community.
All right. Thank you everyone so much for attending this today's talk story. A very special mahalo to our special guest speaker, Dr. Ray Seitz, for her valued time and just her helpful perspectives, and so much information and updates shared in today's talk story. For those of us joining on Zoom, there will be a quick 8-question survey that is going to pop up on your screen. If you could please make the best selection possible for all 8 questions and then click the submit button below. We would really appreciate it. Lonnie, thank you so much for just presenting. And I just want to let everyone know, for those of you on Facebook, please send your thumbs up or your hearts if you enjoyed this presentation, or send a mahalo, any comment or thank you to our guests as well. We would love to get your feedback on today's presentation. Your input will allow us to gain a better understanding of how we can better serve our community with presentation like these in the future, and even our Talk Story guests. If you feel that you have benefited from this presentation, please let your friends and family know that they are welcome to join us every month, the 10th of every month, sorry, at 10 o'clock. Just RSVP to myself for the Zoom link, or tune into Facebook Live on the 10th. Again at 10. Thank you so much again. I do see everyone going ahead and putting in their questions, or excuse me, submitting their answers. Lonnie, do you have any closing remarks that you want to share with us?
I'm just so excited to, and feel so honored to have Dr. Seitz weigh in on how passionately she believes in palliative care, and how that is going to be the catalyst that will really lift all ships in the harbor. I'm super excited about that. I think that's going to make quite a big difference across the state if everybody has access to palliative care.
Yes, I definitely agree. I loved, just her explaining everything so amazingly and so thoughtfully as well. I mean, we could all just understand, and the comfort that comes around the families when everyone is, or the families are on on palliative care. Sorry, ladies and gentlemen, it's been a longer morning. But yes, I agree. We got some comments in just thanking you very much, Lonnie, for sharing your information and your stories about Heaven Airlines. That seems to be
Thank you, everyone. I mean, sending love right back to you folks. Thank you so much for tuning in today too. And please let your friends and family know that we do this on the 10th at 10 every month. So please tune in and let us know if we can help anybody else that might really benefit from this type of information as well.
Yes, thank you so much. I'm going to go ahead and end the polling right there. I appreciate everyone that has been submitting their answers to us. Again, it'll just really help as well. Thank you so much. I hope everyone has a good rest of your Thursday morning. Aloha.
Thank you. Thank you, everyone. Thank you so much for tuning in. Aloha.